Hi, everyone. This is Karen from Women's Abundance. I am back, and I'm really excited to speak with you today and introduce to you our next guest speaker, Dr. Tammy Neuhaus. She is, you're really going to enjoy her because she's brilliant. She's got a lot to share about menopause and perimenopause. She is currently the Chief Medical Officer at the Cusp. And as you all remember, I interviewed Taylor, the CEO from the Cusp, a few weeks back. Tammy has been with the Cusp for the last 8 months. Prior to that, she was with Private Medical, which is a super exclusive concierge primary care service. And when she was there, she started and founded the women's health practice there. The reason why I am bringing Tammy to Women's Abundance today is her team was going to speak at the Women's Health Panel that was postponed due to COVID earlier this year. And Tammy has deep, not only personal medical knowledge because she's an OBGYN, but she personally, similar to me, was surgically forced into menopause early. And so she has kind of a deep passion for helping women understand all of the symptoms and things that can manifest during this time in their lives. And so I'm super excited to share her with you today. And Tammy, welcome.
Thank you, Karen. It's a pleasure.
Yeah, I thought we could get started with really just having you share with the audience about your story and you know what made you passionate about what you're doing.
It is almost serendipity that brought me to the Cusp, Karen. Like you said, I am a gynecologist, an OBGYN, and I have been for almost 18 years. I don't know how that many years have passed, but it's true. And all along in my career, my practice has essentially grown up with me. When I first started, I delivered a lot of babies, and I was having babies too. And then I moved from that first practice to the private medical practice where I was just focusing on gynecology. And I was in my early 40s, and it became very clear that most of my patients were also now in their 40s, late 40s and early 50s. And everybody had questions about perimenopause and menopause. And I was noticing so many patterns and so many changes. And I realized that my patients didn't know enough about the midlife transition. And I didn't know as much as I should have, being a gynecologist. Around this time, I finally did a hereditary cancer test that I had been thinking about doing for many years, given that I'm Ashkenazi Jewish. I had a grandmother who'd had a mastectomy in the 50s, which at that point, you know, any sort of breast lump was treated with mastectomy. But she'd also died of pancreatic cancer, and at her death, she had a melanoma. So those are 3 of the big primary cancers associated with the BRCA2 mutation. And I've always wondered about my family and should I do the testing. And I finally did it about 2 years ago with Color, which happened to be my CEO Taylor's first company. And lo and behold, I do carry the BRCA2 mutation. So all of a sudden, when I had previously counseled patients on preventative surgeries for hereditary cancer mutations, suddenly I had to make this thing for myself. So it was very eye-opening for me. And suddenly, you know, instant menopause, surgical menopause, was very much a topic that I cared deeply for and passionately for, and researched to the hilt and found myself, you know, finding all of the variations in hormone therapy and non-hormone therapy, and analyzing the WHI study and really looking at why my residency, my education suffered as a result of that study, and how there was a huge gap, there was a gap in my knowledge. So 3 preventative surgeries later, and a lot of estrogen patches, which I happily wear, and a sort of re-education through the North American Menopause Society, I found myself being very comfortable and passionate about educating women for perimenopause and menopause. And it was around that time that a mutual friend introduced me to Taylor and the Cusp, and as they say, the rest is history.
Yeah, I'm so excited that you're here, and that I think when a woman actually goes through perimenopause and menopause, it brings so much empathy to the topic and to the situation. So similar to you, I found that when women ask me about hot flashes, I could instantly, you know, empathize with them and relate to them. And same with the arthritis and all of the other things that are going on. So as we move away, and thank you for sharing your story and actually being so vulnerable about that, because I'm sure a lot of women with BRCA wanted to face the same difficult decisions. And I think it's really important to have models like you. The added benefit of having a model like you is that you're also an MD, right? So you can actually prescribe or give information from a more tried and tested perspective. But moving kind of into the cusp, as you are counseling your doctors, and I think what I said on my last interview with Taylor, the one thing I love about the cusp is that you've got a variety of medical practitioners there, right? So it's not just Western MDs, you've got functional MDs, you have acupuncturists, and then you're very keen on lifestyle. So how does the cusp meet women as they're kind of entering those phases, and how do you describe and what differentiates your how you lead the doctors at the cusp?
I think that's a fantastic question, Karen. And honestly, it's one of my favorite things about the cusp too. I had a very traditional Western OBGYN education and training, and I have loved working with and learning from our naturopaths and our integrative physicians. And we have two world-class neuropsychiatrists on our medical advisory board, as well as dermatology as well. And we've really brought about the best practices for improving health and wellness through the midlife transition. And our cusp method, if you will, really is based on the foundation of healthy lifestyle choices. I mean, there's so many things that a woman can and should do to help offset a lot of the symptoms and changes of perimenopause and menopause, like mood swings and sleep issues and weight gain and irritability. Just, appropriate eating, when and what, and creating a better mood and meditation for sleep. All of these things really improve the quality of our life. We know that exercise is the single most important thing you can do to decrease your risk of cancer and diabetes and cardiovascular disease. So really we try and bring in a very holistic approach to helping women and giving them what they're looking for. I mean, there are women out there who want to do all of the lifestyle things first and see how to improve themselves. There are other women who want to go straight for the hormones, just give me the drugs. And then there are a number of women who can't take hormones, whether they've had a GYN cancer or breast cancer, or they have a genetic mutation for a blood clot. There's a lot of reasons why women wouldn't or couldn't take hormone therapy. And that's where it's really amazing that we have brought in all these best practices from our naturopaths about which botanicals may actually be beneficial. How do we balance mood? What are some of the non-hormonal prescription medications we can use that our psychiatrists are very familiar with? So this is one of the amazing things that we've done is we've pulled together these protocols about, what sort of remedy women are looking for, what can they take, what do they want to take, and we've really sort of coalesced it into a list that works. And we train our providers with these medications and how to use them and how to educate. And so much of what we do is educating our members really on how to sort of set themselves up for an easier transition and then a healthier, happier, longer life.
Yeah, and I can't wait for when COVID-19 lifts and the panel can come back. And even if we have to do it remote, one of the things that we wanted to do with Brad and then other practitioners in this space is really educate and do some deep dives. So pick a topic and do a deep dive on one topic, right? Whether it's hot flashes, our particular theme was going to be sex and all the GSM categories, because so many women have vaginal dryness or pain as they're going through these changes in the vagina. So yeah, I love that you guys write great blogs, and your education, forward, which is fantastic.
I
Um,
love that you just brought up GSM and vaginal dryness and irritation, because GSM, genitourinary syndrome of menopause, is changes in the bladder and the vulva and the vagina due to a lack of estrogen that can cause thinness and irritation and pain with intercourse. It also causes bladder leakage and bladder urgency and frequency. And a lot of women don't recognize these symptoms. And these symptoms often start in their 40s. The
right.
vaginal dryness, itching, urgency, frequency. We also know that women are terrible about going to the bathroom when they should. So they overextend their bladder, and there's urinary dysfunction. But I think that one of the single most biggest misconceptions is that you can't use vaginal estrogen. I mean, I recommend vaginal estrogen for almost everybody if there's dryness or itching or bladder. It's transformative. And it always, if a woman is constantly thinking about her vagina or her bladder, something is wrong. You should not have to think about that unless you want to.
Right. And Tammy, the other things, and with the psychiatrist that you have on staff, and I'm really getting into the Instagram community around menopause and all the people around the world, right? This is one part of life that no woman can avoid. And some start it sooner, some are, perimenopause, and some can start in their 30s. And then the first panel that we did, I was shocked at how many women didn't know all of those things that you just mentioned around GSM. And so because I think the more we can raise the awareness, so people think, oh, maybe I'm actually going into perimenopause or menopause, that's not just me being crazy, just knowing that they're not alone and knowing it's normal. I think one of the other big things that I'm really trying to do with organizations like yours and everyone else is remove the shame around menopause,
Yes,
right? Like,
I
women
agree.
need to be totally okay with talking about these topics, being okay to ask their doctors, and really being forward about asking their doctors and not being shy. Because I remember so many women in the audience raised their hands about UTIs and didn't know that you could have more UTIs post-menopause. I mean, that's just a big aha for a lot of women.
Vaginal estrogen fixes that. And not only should the women feel comfortable asking their doctors, but the doctors need to feel comfortable asking their women. I mean, we ask everybody about, vaginal dryness and itching and bladder issues and pain with sex, because some women don't feel comfortable bringing it up, but it is a very, very important part of women's health.
It is. And how do you advise some of your patients, or even like, how would you advise the women who are listening to this? Like, what should they ask their doctors? Because you and I know, or even Taylor and I spoke, a lot of OBs don't even know about perimenopause and menopause because they have to study extra. It's like a specialty nowadays. So what do you recommend for the listeners? Like, how should they talk to their doctors more about this?
Well, I think that some doctors don't have the time to properly address. It is a big conversation. It takes 30 to 40 to 50 to 60 minutes to really understand what's happening in your body and what you can do about it. And so many OBGYNs are running out to deliver babies or have 30 patients on their schedules. And so I really think that it's about finding the right doctor to talk to, whether it's your OB or your family medicine doctor or your internist. I mean, lots of people can be the right person to talk to, but you need to make sure that they're familiar with the current literature and research and that they're comfortable. If they say, oh, it's natural, you just suck it up and go through it, that's not your doctor. Your physician should be somebody who spends time with you and feels comfortable addressing your questions.
And that's why really women, since all women are going to go through this, should be trying to reach out to doctors similar to the ones at the Cusp, right? Or reach out to the Cusp, because you know that your entire staff has, from beginning to end, healthcare that is focused on that phase of life. So I think, if women have the option, going to somewhere like the Cusp is a great transition, because you're probably getting out of your having baby age and it could easily transition from your OB into OB and the cusp, or OB and then the cusp, or, you know, doctors that specialize in menopause, because I don't even know how OBs, is there a special category at the end of their name that says or did they just advertise that they specialize in menopause?
Well, if you are a North American Menopause Society certified provider, then you do have additional initials after your name. Like I have the NCMP.
Oh, right.
So that's the initials that you would look for. You can also go on the NAMS, North American Menopause Society website, and search by zip code for a certified provider in your area. And, you know, even at the cusp, we're not meant to replace your primary physician or your gynecologist. We really are a specialty service to help manage the perimenopause and menopause, give you the education and the tools to do this, and really set you up. Obviously, we evolve and we plan to take care of women, but we're starting with this midlife transition right now.
Oh, that's so fascinating. Okay, so one final question. What would you advise? Like, do you have any tips on lifestyle, or what's your, if you have three or four tips that you want to advise women on, what would you say, since you've been through all of this?
So I think that the simplest tips that women can start doing immediately to feel better and sleep better is really looking at their sleep-wake cycles. I like women to move their calories, their eating, into daylight hours, and make sure that you have a decent window between when you finish eating for the evening and when you fall asleep. Sleep should be restful. It should be in a nice, cool environment. You shouldn't be recovering from a workout. Exercise should be done in the morning. You shouldn't be trying to digest a huge meal. You shouldn't be full of alcohol or tobacco or anything like that. And it's a time for your body to rest and sleep. I think women tend to do too much before they go to bed, whether it's exercise or being on their phones or screens. They eat too late at night. And all of this causes major sleep disruptions, including night sweats and spikes in blood sugar that keep you up all night. So just being mindful of eating during the day, letting your food completely digest and your body cool off before you go to bed will immediately start help with sleep, mood, and night sweats.
Thank you so much. I love it. And you guys, there's so many more tips, right? But I love that you hit sleep, because I always think that people forget about how important sleep is and the cycle. So I'm glad that you gave that tip. And of course, the exercise and the other lifestyle tips earlier. But anyway, I'm glad that you were able to take a little bit of time out of your busy, hectic schedule, COVID-19 day. Thank you so much, Tammy. And for folks on in the audience, I want to remind people that the Cusp has been really incredibly generous and are giving a special discount offer for listeners. And we put the code in Taylor's interview, and we'll put it again in Tammy's. So if you have not visited the Cusp, feel free to. And they've got great doctors, great practitioners. And Tammy, it was such a pleasure to
Thank you for having me, Karen. You're so lovely. Thank you.
All right, have a great day.
You too.
Thanks.
Bye-bye.